here's Ed Bernstein.
Hi, today we're going to talk about two novel ideas on how to keep you healthy. And with me to help me do that is physical therapist Scott Pensivy. You got to say the name. Pensivy.
Pensivy. Right.
Pensivy. We discussed this before the show. R.J. Williams, who's also you're a physical therapist also.
Correct.
And as well as Mr. Mortensen, Dr. Mortensen, right? James Mortensen, who's a doctor of physical therapy. Now, I mean, you've been in town for a long time doing,
26 years.
Yeah, very prominent physical therapist, great reputation. And recently, you've been working with resolving vertigo issues.
Correct.
Now, what exactly is vertigo?
Well, vertigo is, in my field, is a dizziness that people get, can be an imbalance, so you feel dizzy, can't get a direction. But my specialists, my colleagues, they're the ones that deal with the vestibular problems and vertigo more so than I do. And so that is probably a better question to ask
Okay,
them.
you mentioned the word, vestibular.
Vestibular,
okay?
right.
Okay, RJ, what does it mean?
So vertigo to us is a type of dizziness where the perception of spinning is coming on abnormally. So our brain knows that we're still, but some air in our sensors telling us that we're moving. And oftentimes for us in our practice, we see patients' eyes move because that's where the body manifests that motion.
These are balance issues, basically. And correct me if I'm wrong, you can have a condition that's less than ideal and not even know it.
Right.
Right?
Sure.
And we're going to prove that in a minute.
Correct.
And you got involved in this because you rehab a lot of athletes,
Correct.
professional college athletes, I mean, some of the cream of the creme of sports.
Correct.
And you made some observations, I guess, that there's ways for them to improve their performance.
Yes,
Right.
that was one was performance and possibly prevent injuries. And so when I merged and partnered up with Fyzical, Fyzical was the best balanced vestibular in the country company, and we've merged with them. And what we're finding is that there may be some relationship between injuries and the vestibular system, and that's what we're testing at our performance center with RJ. He comes there once a week.
But you can also test, how the technique of how a quarterback throws a ball and how there's balance and center of gravity and everything works, right? And improve that. Now, let's do a demonstration. Blaine, one of our cameramen, has volunteered to be a guinea pig. Now, he has not tried this before, but this is a typical test that you'll do to determine if somebody has vertigo, and it's like almost half of us do.
Correct.
Right, so Blaine, if you can stand over here, and then don't stand in front of the camera when you talk to him, James.
All right. So what I want you to do, I'm going to have you walk heel to toe, one foot in front of the other, with your eyes closed. All right.
Let's have him do it with his eyes open first. See if
eyes
he can
open.
do it.
All right.
Okay.
Head tilted up. All right. This is a good way for us to test just general imbalance.
Okay. But you need to capture his feet, guys, camera guys. Okay. Now you want him to do it. Okay, that's good enough, Blaine. Come back. Reset.
Turn
reset.
around.
Now, you want me to
So
do it
now
with
once we take away one of your strong sensory systems that your body utilizes for balance, close your eyes, do the exact same thing. Theoretically, you should be able to walk.
No, show his feet. Yeah.
So we can see the sensory systems are not integrated well.
Now, you were being legit, right, Blaine? You could not balance like that at all.
No.
Right. Never knew you may have a vertigo issue.
No.
Okay. Now, with a little bit of some exercises that these guys can prescribe, you can perfect that. And then what would that result in Blaine being able to walk with his eyes closed and his head up, right?
Right.
But for a professional athlete, it would have significant effects, right?
Exactly. So what we find is that the exercises help to decrease dizziness. That's essentially what we're trying to do is most of our patients come in complaining of dizziness, all right, vertigo being one of those symptoms.
In the shower, put your head back or bend down and everything starts spinning.
Yes, and there's a number of different reasons why somebody might have that. However, when we get back to retraining the balance system, these are the types of exercises that one might do.
Now, you at your clinic, you have some equipment there that can test as well, more efficiently than what we just did with Blaine, right? So you have a machine there called what is this thing? The Epley or?
The computerized dynamic
Do you have a
posturography.
picture of it, I think? Yeah. And so, can you put the picture up?
Yeah,
There we
yeah,
go.
exactly.
So
there we
how
go.
does that work? Just freeze on it.
So what we're doing in this video is the walls can move around
Right.
the patient that's in there right now, and the floor can move on her as well. So what James was mentioning in challenging your systems that keep you upright and steady, we can mess with a patient's ability to use their feet, their eyes, and we actually look at how the ear is telling their body where they're at in space.
And that gets calibrated somehow, right?
Correct. So
Yeah.
we do a handful of trials where nothing moves. We watch their performance, and then we slowly add in more challenge.
Okay, so that's one test you do. Then you have a set of goggles here on the desk. And what do you do with those?
So these goggles allow us to watch the eyes move in the dark, where we were talking about earlier where the eyes are the manifestation of that dizziness. Sometimes a patient's eyes will start to spin, what we call nystagmus, when you lay people back in different positions. Again, we've got video of that here. We see the eyes kind of moving abnormally when they should be steady. That lets us know that sometimes the air in the sensors or the ear is misfiring, and now the eyes start to jump around, and problems come out of that.
This all has to do, and Scott, you were explaining to me earlier about the crystals in your ears. You related them to like icebergs or something?
Yeah, well, iceberg's one, and another one I like is just, you ever play that game where you have those little balls and they have to go into those little the sockets when you're moving them around, and they all got to line up, and then you're set. It's like a game. What's kind of the same thing. These guys take that kind of game and they play with those crystals to get them back into those where they need to be, so you have better balance.
So your vertigo is a result of these crystals being out of whack in your inner ear, and then the exercises help put them back together? Is that like a
So what we do
simplified
is
version?
we isolate if there is debris, they're called otoconia clinically, in the ear. Your right ear and your left ear communicate with each other and communicate with the brain. The ear is based on fluid dynamics, all right? If you tip your head one way or the other, there's fluid that courses through the canals of the inner ear. That debris can sometimes block fluid on one side, and your brain gets an altered message going in. That's creating that perception or that illusion of motion, creating dizziness. Through a quick maneuver, we can reposition those crystals back down into the bottom of the inner ear, and then at that point, the recalibration process can occur.
How long does that take to do that, James?
Typically, the maneuver, it's just a couple minutes to do it. Now, sometimes it's more successful than others. Sometimes, it takes more than one treatment, but there's a pretty good success rate.
But most cases of vertigo you can get resolved in what period of time?
Typically, if they're having nystagmus, or what's called BPPV, benign paroxysmal positional vertigo, we can clear that up immediately, and after 3 to 5 days, we can bring them back in and test them, and usually that's gone.
Wow, that's amazing. Now you have a third test, computerized dynamic posture or something like that. What is?
That was the box that we were showing.
Oh, that was- okay.
The chair
chair.
here is where
Okay.
James is talking about being able to move people around. This is the Omniax chair.
Yeah, you'll never get me on that.
Yeah.
Yeah, there's only, 12 in the United States?
Yeah, and Fyzical in Las Vegas has 2 of them, and then another Fyzical franchise we have out in Florida has one as well.
And the Rehabilitation Center has one here.
What they use for Parkinson's, right?
Yeah, they're doing studies over there.
Right.
And concussions, and that was another thing that brought me is my athletes with concussions. The big buzzword right now is concussions, and these guys are helping me get these people better because you have a cerebral concussion or a vestibular concussion, correct? And you can treat the vestibular one much easier than you can treat a cerebral.
I mean, so you can have some impact to your head, whether it's a car accident or a football injury, and a couple days later you're better. You think you're better, but they check for concussion, or you may not have a closed head injury, but they don't pick up the vertigo aspect, right?
Correct, and that was kind of what brought me to join the company. Is now we're able to. Most of my athletes will say, "I feel pretty good." Well, feeling pretty good and feeling top of the game is what we want, and so we don't let that person or that athlete go back into the game until they pass the computerized test, because it's not subjective; it's very objective. It tells and compares you to norms, and there's no way to do that just asking you, "How do you feel?" "I feel pretty good." Well, now we're going to test you. And this is just another way to really go after the person, take care of them.
And you're doing both at your center.
Correct.
I mean, you have, I go for rehab at your center. I should disclose that because I have some rotator tears, and and you treat people for physical therapy as well as training athletes and treating the athletes that you're training if they have any kind of injury or vertigo or concussions.
Correct.
You also have a machine. You got so much going on there. I'm talking fast trying to get through it.
Okay.
You also have a machine called Miracle Wave.
Correct.
Right, and this is a machine that that you discovered in Germany?
Correct.
And why don't you tell that story?
So about 3 years ago, I had a pro athlete that had really severe tendonitis of the knee. There's tendinosis, and I did everything. I treated him for about 6 months. Couldn't get him better, other than about 70%. Always had it. So we flew him to Germany. Had this technique called Miracle Wave or Shock Wave, which goes in and breaks up the scar tissue. And within 2 visits, the pain was gone, and he was back in the court, and it hasn't returned. So I was very interested in that. But the problem was it was a $200,000 machine, and the FDA didn't approve it here in the United States. So all my athletes were being sent over there for this technique. Then what happened is about 6 months ago, this we call it acoustic wave, the Miracle Wave, got approved here in the United States. And I was able to, this athlete that I treated said, you know what, I'm so happy with what you did for me. They gave me the unit. So now I have it in my clinic, so I can use it for anything.
Right.
And anybody.
And this is non-invasive.
Non-invasive.
You know, I've used it myself, and it breaks up the scar tissue, right? And the fluids and inflammation in my shoulder and whatever body part you're working on.
Correct.
And it takes 2-3 minutes to do a session. And it's kind of this radio waves, you know, bum, 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 kind of banging into my shoulder, right?
Yeah, they're actually physical acoustic waves that go in, and again, your muscle has a certain frequency, and scar has a certain frequency. So it passes through the muscle, and then when it hits the scar, it's a different frequency, and it recognizes that, and then blows it up and gets rid of it.
And it does, you know, seem to make you feel better as soon as it's done. I mean, I was able to walked in there, couldn't raise my hand further than this, and I was able to get a range of motion after the
We've
treatment.
had only about 6 weeks. I've done probably 500 treatments, and I'm probably getting about an 82% success rate with it. So.
Yeah. Is there a way to avoid vertigo?
The inner ear is going to weaken with age in general. So we're talking a lot now about preventative care. And that splits us into two avenues. One, the general population. What can we do to capture them early and get them healthy? And then 2, for these athletes, how can we actually improve their performance above a general person? And going back to the eyes, the way those eyes move, we have tested a few athletes at Scott's clinic where they're testing almost 2 times faster eye tracking ability than a normal person.
Well, I mean, they got to be hungry for that kind of treatment, right? I mean, that's the difference between winning and losing.
Right.
And we have some guys that are top of their game, and they're only doing 25% of norms.
Right.
Top of their game. So imagine if we can make them, 90% of, they're going to be a better athlete. They're going to have less injuries. And again, these are just ideas that we're coming up with together that I think eventually we're going to be able to prove some really good data.
And does a typical person need to resolve their vertigo? I mean, other than, I mean, look, as I said earlier, sometimes people don't even know they have it.
Right. So, I mean, as a qualifier, you have to find out the reason why they may be having vertigo or dizziness. There's more than one reason. Not all reasons can necessarily be treated with physical therapy. Some of them are due to medications they might be taking.
Neurological issues.
There's other issues. However, if someone has dizziness that is the type of dizziness that we treat, it is something that needs to be fixed because in the long run it doesn't fix itself. We don't necessarily understand why. Some people's inner ear doesn't recalibrate all on its own and some people's does. But what we do know is with the treatment, the majority of our patients, they leave feeling much better in the long run.
Is there a correlation, when you have, most of us go through this with our children, they get, fluid in their ears when they're young, and it used to be in the old days they put tubes in your ears, and is there a correlation between that and these kind of problems?
Yeah, we do find patients who have had inner ear pathology before or even middle ear pathology like chronic ear infections. They're more predisposed or may have more issues with vertigo or dizziness in the future, but the evidence does support the fact that vestibular rehabilitation, which is what we do, can help those people.
Yeah, so sinus infections would also obviously impact that.
Any changes of pressure into the head, into the cavities, is going to push into the cavity that the vestibular system sits in. So in our skull, it sits in a small little space right kind of behind the ear bone here. So as pressure changes, there's a likelihood that you're going to affect the pressure of the ear.
And how does that correlate with like getting injured in a car accident?
Oh, that's another thing that one of the things that I do work with physical, and we've had some great results with, is with like whiplash. Well, a lot of times when you get hit, your head goes back and forth, and you're getting micro trauma.
Right. So you're shaking those crystals loose.
Correct.
Right? With that
And so
trauma.
we used to just treat them with, when we say whiplash, soft tissue injuries. We do mobilization. We do all the soft traditional therapy. Well, what I've been doing is coupling it with the vestibular specialist, and we're getting people faster back to what they really want to feel than these people what we call cervical vertigo, which is it's all coming from the neck, but it's also relating to the ear. Connecting those two and breaking those both apart, that's when a person's going to get better faster and quicker.
No, these techniques were not even really available, 10, 15 years ago.
No.
Right?
Yep. Even in physical therapy school now, the amount of vestibular rehab that they cover is maybe a seminar, a weekend, or just a single lecture. But we see in the board exams for licensing, the amount of vestibular questions is getting bigger and bigger. So it's becoming more known of how important this system is.
Yeah. So all these things are new, they're exciting, and it's a way to maximize your health.
Correct.
and to help repair injuries as quickly as possible. I have a guest coming on now who has a flotation center in Las Vegas. This is another method of maintaining optimal health. So we'll be right back. We're going to talk about how you can quietly float yourself to better health. Accidents don't discriminate. They can happen anywhere to anybody. It really comes down to results.
Enough said. Call Ed.
I'm Ed Bernstein, and I've been getting those results for nearly 40 years.
EdBernstein.com.
Well, if you have trouble sleeping and or relaxing, or you just want a really unique experience, we have something now in town called a float center.
Yes.
And with me now is Travis McQueen, and I told you you should go into Hollywood with a name like Travis McQueen.
Steve McQueen.
Yeah, well, it just sounds like a leading man name, not the short Raquel Martinez, who are the two owners of the Float Center. Now, I learned about this because my daughter is a customer of yours.
Yes.
And you're located over on Rainbow, right by between Russell and the 215 there, right?
Correct.
And these are what, like pods you have? Explain to me what this is, and I think we have a photograph of it.
Okay. So they're float pods, originally called sensory deprivation tanks. They're full of 1,200 pounds of Epsom salt that allows you to float on the surface of water effortlessly, just like the Dead Sea, impossible to sink. She actually takes 2 and 3 hour naps in these things, wakes up in the exact same spot. The water is heated to skin temperature. You're going to turn the lights out when you get in the pod. You can start with music. We recommend nothing, but some people need it to get comfortable. So eventually you can't see anything, you can't hear anything, can't even feel your skin after 5 minutes unless you pick your arm up out of the water. So what that does, it frees up about 90% of your central nervous system, as well as detoxing while you're in the water, because magnesium sulfate is what Epsom salt is. So you're detoxing, you're relaxing, you're going to sleep better. It's going to get you into a theta wave state. That's why athletes use it for visualization, because you're able to retain things more. Without that external stimuli, you're just able to go in there as an athlete and work through whatever you're doing, whether it's boxing or whatever.
This sounds to me like a no-brainer. I have difficulty sleeping, and you were saying earlier that you also wake up several times a day.
Several times.
Because we have not only the internal stimuli, but we have all this external stimuli, and it's when you're essentially turning off your machine, your body. You're turning everything off.
Yes.
Right? And the whole floating thing, Raquel, with the salt and everything. I've been to the Dead Sea, and I know that when you are lying in the Dead Sea, as weird as it sounds, you cannot go underwater. I mean, you're just floating on top. And you have the same kind of situation with what you're doing here.
Exactly, same concept, and it heals your body.
When you say it heals your body, is there, when people talk about meditation and those type of things, they talk about in terms of doing it for 20 minutes. When Travis said you spent 2-3 hours in there, can you spend too much time in there?
I don't think so.
What is a typical session?
A typical session's an hour. Everyone's different. I can't stay in there for more than an hour and 15 hours, maybe an hour and 30 minutes max, because I completely just let go in there. Like, after about 20 or 30 minutes, the fact that you have none of that external stimuli, you kind of just literally detach from your body. It's like you have no physical vessel anymore. It's just your thoughts. And you go into such meditative state, whether you meditate or not, you're just kind of gone. Some people go in there, they see colors, they start dreaming while they're awake. And that's really all you're thinking about. Then you come back to it and you're like, oh my gosh, where was I just at? Like, it's just like hitting the reset button. Like an hour in that pod is like a 3-hour nap, it really is.
And how does this work, Raquel? You have like these little private rooms where people can disrobe and prepare in their nude when they're going in? To the,
Yes,
pod?
everybody has their own separate room, so it's very comfortable. You have your own shower, your own pod. You are naked, but...
And when people finish, what do you typically hear from somebody? You know, they've done their hour in there. First time they're there, they don't know what to expect. They come out and what do they typically say?
This is amazing.
Amazing or awesome? That's the two most common words that we hear.
Wow.
Yeah.
And how many of these rooms or pods do you have?
We got 4.
4 of them. So you can do 4 people.
Yep.
And so, but you don't, I mean, everybody has their own individual. This is not a couples thing. This is not, right?
It totally defeats the purpose. Then you don't get rid of all that external stimuli. When you're getting rid of the external stimuli, that's when your brain is able to completely relax and kind of hit the reset button.
Now, I assume that your body does, you get salt on your body, and you have to shower and rinse the salt off, right? I mean, that can't be good to be walking around with salt on your body.
No,
right?
I've had a couple people come out and obviously didn't shower very well after and just covered in salt, because you can have 2 to 3 cups of Epsom salt on you when you come out of there.
Right.
Because like I said, there is 1,200 pounds of it, you know.
And why is, and you were talking about salt being healing in a lot of ways.
Well, Epsom salt is magnesium sulfate,
Right.
which is one of the most important minerals your body needs.
Right.
And
You twist your wrist or your ankle, they tell you to
I have a lot
put
of
in
older
Epsom
people
salts.
that come in for arthritis, which I have arthritis. I have a bulge disc, tendonitis, knees, elbows. Like, I'm a mess. And if I float regularly, which I haven't been doing because we're so busy, I just feel better. Just my back feels better. Everything feels better. Like, you're increasing endorphins when you're in a theta wave state, which is what you get yourself into when you get in there and lay perfectly still. Like right now, we're in a beta wave state. Our brain is firing really fast, processing all this, external stimuli. In there, you're in a theta wave state. Everything is processing slower.
You know, as you're describing that, I was thinking this is almost like, being, in uterine. I mean, being, you're, a fetus, and you're kind of floating, right? And and everything's quiet and dark, and
it's akin to being in the womb. That's what everyone says. Yes.
Well, yeah, it's fascinating. I mean, how much is this?
It's a single session is $79, but until the end of this month, and maybe for the first couple weeks of next month, it's $45, because we just opened in February. So.
And it's different than like what you would find in a typical spa.
Way
Right.
different. It's a totally different. It's an experience. It's not just going there to relax.
Right.
You coming out of there. Everyone has an experience. We have a book that people write in. You can read all their experiences in it.
Is there a science to this? I mean, has there been research on
Well, it was
this?
created by a scientist in 1951, John C. Lilly, and he did it to do studies on some of his groups, whatever he was working on, to see how it would affect with basically, the brain having no external stimuli, how the brain would react and the body would react to the studies he was doing.
And is this effective for any age? I mean, can you bring children? I mean, is there an age restriction or anything?
If it's a small kid, like my cousin has an autistic son, and she gives him Epsom salt baths because it detoxes you, it strengthens your digestive tract, and that allows toxins and heavy metals and stuff like that to come out, which is important for some kids that have autism. So if it's a little kid or something, it would have to come at a time when we're not booked, because you got to be really quiet, but the parent would have to go back. Like 14 and over is about the age we would let go back by themselves. Any younger, a parent would have to stay in the room. We do have some senior citizens that come. Their family member comes and helps them get into the pod and helps them get out.
And how deep is the water in the pod?
10 inches.
Oh, so you don't have to worry. You don't have to worry about falling asleep and rolling over.
Impossible.
That would be my fear. You know?
Well, it's impossible to roll over. To roll over, you got to be able to push off something. There's
Well,
nothing
that's
to push
true
off.
because of the density.
And if your face hit the water, your eyes would
Burn a little bit
burn,
from the
yeah,
salt.
from
so
the
you're going
salt.
to wake up real quick.
You wouldn't want
Yeah.
that salt water in your
Right,
in
so
your
the
face
idea is
at
to keep
all.
the salt out of your eyes,
Yes.
out of your nose, your ears,
Yes.
and out.
Which we have a video that we have our first-time floaters watch that explains everything.
Yeah. Is there a learning curve for, or most people get it very quickly?
I think so, a little bit. Some people can relax right away, and other people need a couple times.
So explain the music thing to me. I mean, because you were saying it's really better without the music, but
really
music
is.
does tend to relax people.
I like the music, and everybody's different. I like about 20 minutes of music, and it just kind of calms me.
So what do you give people, headphones, or how does the music thing work?
There's speakers in the pod.
Oh, you pipe in and
Yeah.
choose your music type of
Everything
thing?
is controlled from the pod. You control the lights in the pod. You shut those out yourself. So if you need to turn them on mid-float, you can turn them on. The music you can turn on and off. And there's also an intercom button. You can talk to us in the lobby if you have an emergency or anything like that.
And the water is exactly body temperature, so you
Skin
don't...
temperature.
Skin temperature. Which,
We-
is that different than body
It
temperature?
is, just because you got air moving over your skin and stuff like that, so it makes it a little cooler. We keep ours about 94.3. Skin temperature is usually 93.5 to 94.5. Most people seem to like it in the low 94s.
It's amazing. I'm going to come over and try this.
You'll love it.
My
Come
daughter,
try it.
my daughter's been raving about it. This is the Float Center. Float Center is in Nevada, and on Rainbow,
Yep, 5875 South Rainbow.
5875 South Rainbow. It sounds like a way to try to get me to sleep. I don't know,
It's
but
good
I
fun.
will. I will try. I'll try.
That's why Tom Brady has it in his house. So
Oh, he's good.
Tom-
Well, I
yeah,
can't
Tom-
afford my own, but Tom Brady.
has it in his house.
Yeah,
Yes.
well, it works for Tom Brady.
Yeah.
Hey, thank you so much, Travis. Raquel, thank you.
Thank you.
All right, thank you.
And we'll see you next week. Go float away.
A little bit. But yeah, it's
Time can change many things, but what doesn't change is our commitment to serve you.
So if you've been injured in an accident, or if you need help in your Social Security or workers' comp case, we can get you the best possible result.
Enough said. Call Ed. EdBernstein.com.